Coronavirus cases are on the rise in Africa and have crossed the 3 million mark, with more than 72,000 deaths. And in South Africa, there's a new strain of the virus which is said to be more contagious. The WHO Regional Director for Africa has called on countries to strengthen measures to prevent health services that are already under pressure from reaching breaking point.
Preliminary analysis finds the new variant circulating in South Africa to be more transmissible, and it appears to be driving the surge in new infections in the country and in the sub-region. Genomic sequencing has found the 501Y.V2 variant present in 3 other countries: Botswana, the Gambia, and Zambia.
South Africa has the most cases on the continent, which could be due to it carrying out more tests. It follows Morocco, Tunisia, Egypt and Ethiopia. Journalist Vinicius Assis says that South Africa's health service is already under strain.
South Africa currently has more than 220,000 active cases. That is, people who have been infected and are still recovering. Except not everyone is in the hospitals. 15,000 people are hospitalized and approximately 2,000 in the ICUs. Authorities' concern is to keep these hospitals reserved for patients with COVID-19.
The head of the South African Medical Association that the second wave of registered cases is much more contagious and hundreds of doctors have died.
Our first wave was mild in comparison with the second wave. But again, it's not that more people are dying, it's just that it places quite a huge burden on the healthcare facilities. We know that more than 300 doctors already lost their lives.
One doctor in Angola, in the province of Ulila, was infected with the new coronavirus variant and hospitalized in an ICU. She's now undergoing physical therapy and says the recovery process can be quite long. She says despite knowing several cases from several colleagues from within the country and abroad, to her amazement, it was a long recovery in many cases, and it also happened to her. She's been recovering for 2 months since contracting the virus. In Angola, more than 700 health professionals have contracted COVID. From January 24th, Angola will suspend flights with Portugal, South Africa and Brazil, countries that have already registered the new coronavirus variant.
In Angola,
the first phase of the national vaccination plan starts in February. The African Union chairperson, Cyril Ramaphosa, has secured the distribution of at least 50 million vaccines to member countries that will be available between April and June. The least affected countries are Tanzania, Mauritania, Seychelles, Burundi, São Tomé and Príncipe.
Neuzi Silva, em Angola para Euronews.